What does time mean for a gunshot wound victim? Everything.
Time is of the essence. People die when they're shot, and car crashes as well, but they die when they're shot from bleeding to death. And so every minute that you continue to bleed without getting it stopped, your chances of dying go up.
Every day, 40 Americans are killed with guns. In many communities, at least 80% of gunfire goes unreported to law enforcement. This means police can't respond, and that there is no deterrent, which normalizes violence. Despite the growth in gun crimes, there are communities who are experiencing a steep decline in gun violence due to a combination of community policing, gunshot detection, and collaborative, passionate healthcare providers. Camden, New Jersey, a population of 75,000, began using ShotSpotter technology in 2013 to address their gun crime. The technology works by triangulating the location of gunshots and alerting nearby police officers to respond. Since 2012, Camden has experienced a steep decline in homicides. In 2017, the total number of homicides was 23, Camden's lowest number since 1988.
Cooper is really the only level 1 adult trauma center, level 2 pediatric trauma center in the region. We see about 4,000 trauma patients a year, and many of those are gun violence penetrating trauma related. So we're fully equipped to take care of those patients, and that's kind of what we thrive on. When I was here in 2012, it was one of the highest murder rates that Camden ever saw, 5 to 10 gunshot wounds a day.
Gunshot victims are 5 times more likely to require blood transfusions, require 10 times more blood units, and are 14 times more likely to die than people seriously injured by other means.
As I was seeing a lot of youth being killed by shootings, my goal really was to study how can we get these patients to our trauma center in the hands of a trauma surgeons for continued resuscitation, for hemorrhage control faster. Our first phase of the study, we started out with just comparing, basic transport time, and we found that patients that were transported by implementation of ShotSpotter and the scoop and run method by the police department arrived to us 4 minutes faster than patients that did not.
Officers in Camden transport 1 in every 5 gunshot and stab wound victims using scoop and run.
Scoop and run has been around for a while, and that means that the police, when they see a shooting, actually put the person into their vehicle and bring them to the hospital. In Camden, we've taken that to the next level. We have used ShotSpotter so that the police now hear when the shots have gone off, triangulate where that is, and so then they send the closest police unit to that site. So they're there within literally seconds. We gave them direct access to trauma admitting number. So as they're coming in with the patient, they call trauma admitting. So when they arrive with the patient, the trauma team is here waiting. So that cuts the time down even further, and time is of the essence.
The next phase of our research will hopefully translate into survivability of the patient. Our research is really groundbreaking because no other group has studied this technology and how it can be used to improve patient outcomes. We are seeing a lower crime rate. We are seeing patients survive the injuries that they normally would have died from in the field. And I think that that's all due to ShotSpotter and police scoop and run.